What is a full code and what's the difference between full code, DNR, DNI, and DNH? A full code means that if your heart were to stop beating or you were to stop breathing, that you want medical professionals to do everything possible to keep your heart going and to keep your lungs going, to keep you alive, even if you're not conscious. What that usually includes is CPR or cardiopulmonary resuscitation, which requires pushing on the chest with enough force to break the ribs, sometimes break the sternum, and sometimes cause other internal damage, which I'll go over in another video. It often requires shocking to the chest. It would also require an artificial airway to help you breathe. And in an intensive situation, that would include something called intubation, where medical professionals will push a tube down your throat and hook you up to a ventilator to breathe for you. Medications and fluids are oftentimes also used. All of these interventions are definitely not like you've seen it on TV or the movies. They are much more intense and there's often a lot of trauma that is caused. And for older adults, people with chronic health conditions, and anyone with a terminal illness, the outcomes are usually pretty detrimental. DNR stands for do not resuscitate, meaning that you do not want CPR. You do not want chest compressions if your heart were to stop. DNI means that you do not want intubation. You do not want a tube shoved into your throat to mechanically help you breathe. And DNH means do not hospitalize, that I don't want to go to the hospital. If anything were to happen to me, keep me at home and really just think about keeping me comfortable. Or at least that's usually what this person means. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. Follow me for more end-of-life education.